Hi, my name is Karen Paklibar. Today I'm going to do abdominal exam. And this is my 360 view. All right, hi, how are you today, Deb?
Good.
Okay, today we're going to do some abdominal exam for you, okay? We'll start first with inspection, auscultation, percussion, and palpation. And as we go along the exam, I want you to tell me if there's any discomfort or pain, all right?
Okay.
First, let's pull up your shirt. Did you have any surgeries before?
Yes.
Okay.
I have a C-section.
C-section? Okay. I'm going to lower it, okay?
Okay.
That's okay. All right, so she's got a scar over here in the pelvic area from previous surgery. Umbilicus is midline. There's no discharge. It's not bulging. It's inverted. I don't see any inflammation in there. Skin-wise, within normal and equally distributed. I can see from some stray, but there's no, other than the previous scar, there's no scars on each side as well. Contour is flat, symmetrical, and quite rounded, but not really bulging. So far, there's no pulsations. I don't see any veins as well. No aortic pulsations. Doesn't show any distensions or any skin hematomas or whatsoever. Now we're gonna do auscultation, Deb, okay?
Okay.
So all four quadrants have normal active, except for the lower has some normal active bowel sounds, but the lower ones, bilateral, has like more gurgling sounds. Okay, are you always having those? Okay, so now we're gonna do for friction rubs. Okay, so we're gonna do the liver. No friction rubs for the liver area. Spleen. Friction rub is also not heard. And then now we'll do the brutes, okay? Aortic, renal, right renal, left iliac, right iliac, and then I'm gonna do your femoral, okay? Okay, all arteries are negative for brutes. Okay. And then we're gonna do the venous hums, okay?
Okay.
Gastric area and above the umbilicus. I don't hear any venous hums as well. All right. Now we're gonna do percussion, okay?
Okay.
And let me know if there's any discomfort along the way.
Okay.
So it's tympanic in all areas, 9 areas. And then let us do your liver span. So I'm gonna bit raise on this one, okay?
Okay.
Resonance. Dull. So this is where we measure your liver span, okay? So tympanic. Okay, it's dull. So we'll measure your liver span, Dev. It's 6 centimeters, okay? Now for the liver span, we are gonna go percuss your spleen, okay?
Okay.
So usually it is tympanic or resonant, but when there is dull, so there is dullness over here. I want you to take a deep breath and hold.
Okay.
Okay. All right. So After that, we're gonna do now we're gonna do palpation. So first I'm gonna do deep light palpation. Let me know if you feel any discomfort or pain when I press it, okay?
Okay.
So far, no tenderness, no enlargement, or no organomegaly. And now I'm gonna introduce some deep palpation, which is like 2 to 3 centimeters, just to make sure if we palpate any enlargements, other organs, okay?
Okay.
Any pain?
No.
All right. And now, after that, we're gonna do a lever edge. So I want you to take a deep breath and then exhale. Okay. One more. And then exhale. All right. So far, I don't feel any enlargement, but we're gonna do this another manual. Okay, inhale and breathe. Exhale. One more. Okay, and then exhale. So I don't feel, I can feel slightly the liver, but I don't think it's enlarged or there's like enlargement in there, and it's non-tender as well. Okay.
Okay.
Now we will do the splenic palpation. Okay. Can you take a deep breath and hold?
No.
Can you hold a little bit and then exhale? Yeah, usually splenic with a normal is not really palpable. Okay, unless if it's large, then it's enlarged, then I could like physically feel it upon palpation. Okay.
Okay.
Now what we're gonna do is for the kidneys. So I'm gonna take a deep breath for me. And then just breathe normally. And then take a deep breath. And also, palpation of kidneys is not also palpable whenever there's no enlargement as well. Now what we're gonna do, Dev, is to also I want you to turn your back from the camera. I'm gonna introduce some pressure in your back, and you let me know if there's any pain, okay?
Okay.
All right. Any pain?
No.
Any pain? Okay. All right. So far, I don't feel any. She doesn't verbalist. There's no pain.
Okay.
Lay on your back.
Okay. All right.
Now we're gonna do some special maneuvers, okay?
Okay.
So we're gonna check for your for any presence of ascites, okay? Usually when there is dullness, there's shift fluid, then that's a sign of there's ascites. And then I don't see any shifting fluids, but I also want you to put your hands in the middle. If there any shifting, I don't feel any shifting. And then turn on the left side a little bit. Okay, no shifting, no sense of shifting of fluid, okay? All right, lay on your back, thank you. We're gonna do some tests also to check for appendicitis, okay? First is the Rovsing sign. I'm gonna introduce some deep palpation on this one, and let me know if there's any pain.
Okay. No.
Okay, so that's for Rovsing sign. If their patient verbalized pain, then that was possibly a sign for appendicitis, or there's presence of appendicitis. Now we'll do the psoas sign. So I wanted to lay a little bit on your side, laterally, and relax your legs, Dev. I'm gonna lift your leg, hyperextend it. Is there any pain?
No.
Okay. How about this? Any pain?
No.
Okay. So no negative signs for psoas. Lay on your back for me. I'm gonna do the obturator sign. Pain?
No.
Okay. So negative signs before obturator, meaning to say there's no, it's negative, there's no appendicitis. To check for cholecystitis, we're gonna check for the Murphy sign. And just relax. I'm gonna lift this one a little bit. You let me know when there is pain, okay?
Okay.
Take a deep breath. Exhale. Take a deep breath. Exhale. One more. Inhale. Hold your breath a little bit. Inhale. Hold your breath and exhale. Negative for Murphy sign. So far, all signs for appendicitis, ascites, and cholecystitis are all negative.
Okay.
So that ends our examination. Thank you, Dev.
Okay.